Every year, nearly 800,000 people in the United States have a heart attack. And the terrifying truth that most people don't know is that the body almost always sends warning signals, sometimes days before, sometimes weeks before. The problem is those signals don't look like a heart attack. Some feel like indigestion. Some feel like a bad night's sleep. One of them feels like nothing more than a vague, unexplained feeling of dread. In the next 15 minutes, I'm going to show you 8 body signals that your heart may be in serious danger, including one that is so commonly dismissed as anxiety that it has its own medical term. This information could be the most important thing you watch this year. Welcome to Body Signals, the channel that helps you understand what your body is trying to tell you, backed by lab values, medical science, and real clinical knowledge. Before we begin, everything in this video is for educational purposes only. It is not medical advice, and it is not a diagnosis. If you have any of the signs we discussed today, please speak with a qualified healthcare professional. That said, the information in this video is real, it is medically supported, and understanding it could help you recognize a crisis before it reaches a point of no return. Here is how we are going to approach this. First, I want to spend 60 seconds explaining exactly what a heart attack actually is, because once you understand the mechanism, every single warning sign on this list will make complete biological sense. Then we'll go through all 8 warning signs one by one. And at the end, I'll tell you exactly what lab tests to ask for and what to do if you recognize any of these signs in yourself or someone you love. Your heart is a muscle, and like any muscle in your body, it needs a constant supply of blood to survive. That blood comes through a network of arteries wrapped around the outside of the heart, called the coronary arteries. Now, over years and sometimes decades, a fatty substance called plaque can slowly build up on the inner walls of those arteries. This process is called atherosclerosis, and most of the time it is completely silent. No pain, no symptoms, often no warning at all. But here is the critical moment. Sometimes that plaque becomes unstable. It can crack or rupture. When that happens, your body sends platelets, your clotting cells, to seal the break, just like it would for any wound anywhere else in the body. But inside a coronary artery, that clot can grow large enough to partially or completely block blood flow to the heart muscle. That is a heart attack, not an explosion, not a sudden mechanical failure. A clot, blocking blood, starving the heart muscle of the oxygen it needs to survive. And in the hours, and sometimes days before that clot fully forms, your body starts sending signals. Signals that, if you know how to read them, could change everything. Warning sign number 1, chest pressure, tightness, or discomfort. And notice, I said pressure, not necessarily sharp pain. This distinction matters enormously, and it's why this sign is so often missed. Most people imagine a heart attack as a sudden, crushing, unmistakable chest pain. And while that can happen, many heart attacks begin with something far more subtle. Patients describe it as feeling like something heavy is sitting on the chest, or a tightness, a squeezing, a feeling of fullness. It may come and go. It might last a few minutes, ease, and then return. Some people mistake it for indigestion or heartburn, which is why this sign is so dangerous. What separates a cardiac warning from ordinary chest tension? 3 things to watch for. First, the pressure returns or worsens with physical activity. Second, it does not go away after antacids, positional changes, or rest. Third, it is accompanied by any other sign on this list. If you are experiencing unusual chest pressure that keeps returning, especially with any exertion, that is not something to wait on. Warning sign number 2, extreme unexplained fatigue, the kind that sleep doesn't fix. And this one is particularly important for women to hear. In the days or even weeks leading up to a heart attack, many patients report a kind of exhaustion that feels unlike anything they've experienced before. Not regular end-of-day tiredness, something deeper, a heaviness that doesn't lift, a fatigue that makes simple tasks like going upstairs or carrying groceries, feel like real effort. Why does this happen? When the heart is struggling to pump blood effectively, your muscles and organs receive less oxygen than they need. The body compensates by prioritizing blood to vital organs, and the result is a systemic fatigue that no amount of rest will resolve. Because the problem isn't rest, the problem is the blood supply. Women are significantly more likely to experience heart attacks with fatigue as a dominant or only symptom, without classic chest pain. This is one reason why heart attacks in women are underdiagnosed. If you notice a dramatic, unexplained change in your energy levels, particularly if it appeared suddenly and doesn't match your lifestyle, your body may be telling you something important. Warning sign number 3, pain in the jaw, neck, back, or shoulders. And this one surprises almost everyone the first time they hear it. How can jaw pain be a sign of a heart problem? The answer is referred pain. Pain signals from your heart travel through nerves that share pathways with nerves serving your jaw, neck, shoulders, and upper back. When your heart is under serious stress, those signals can feel like they're coming from somewhere completely different. Many people with heart attacks describe a dull ache in the jaw that they initially thought was a dental problem, or a burning sensation between the shoulder blades that they chalked up to a muscle strain or bad posture. Some describe a tension that runs from the left shoulder down the left side of the neck. Women, again, are disproportionately likely to experience heart attacks with jaw or neck pain as the primary symptom, without any chest involvement at all. If you are experiencing unexplained pain in any of these locations, particularly if it comes and goes without a clear physical cause, and particularly if it is paired with any other sign from this list, do not attribute it to your dentist or your mattress. Let your heart be ruled out first. Warning sign number 4, shortness of breath, especially at rest or with minimal exertion. Most of us expect to feel a little breathless after climbing stairs or a brisk walk. But when shortness of breath happens while you're sitting still or during activities that have never made you breathless before, that is a different signal entirely. Here is what's happening inside. When the heart isn't pumping efficiently, blood can back up into the vessels of the lungs. This causes the lungs to become congested with fluid, a condition called pulmonary congestion. The result is that sensation of not being able to take a full breath, even when you're completely still. Some patients describe waking up at night unable to catch their breath. Others notice they need to sleep with more pillows to breathe comfortably. Others feel a persistent, mild breathlessness that they attribute to being out of shape, even when their activity level hasn't changed. This is a symptom shared by both heart attack and early heart failure. If your breathing has changed in a way that doesn't match your activity level, your lungs may be responding to what your heart is going through. Warning sign number 5, cold sweats and nausea. And this combination catches people completely off guard because it can feel exactly like a stomach flu or a bad case of anxiety. Here is the mechanism. When your heart is in serious trouble, your body activates the sympathetic nervous system, the fight or flight response, in an attempt to compensate for the reduced cardiac output. This triggers a surge of adrenaline. That adrenaline surge causes sweating, but not the warm, exercise kind of sweat, a cold, clammy sweat, the kind that appears even when you're sitting completely still. The same adrenaline activation triggers nausea and sometimes vomiting. This combination, cold sweat plus nausea, is particularly significant in women who are more likely than men to experience these gastrointestinal symptoms as a primary heart attack presentation. Many women who later learned they were having a heart attack initially believed they had food poisoning or a stomach bug. If you feel suddenly nauseated and break out in an unexplained cold sweat, particularly if there is no obvious cause like heat, food, or illness, this combination warrants immediate attention. Warning sign number 6, pain, heaviness, or tingling in one or both arms. This is one of the most classically known warning signs, and yet it is still routinely missed or rationalized away. Like jaw pain, arm discomfort during a heart attack is a form of referred pain. The cardiac nerves, particularly those on the left side, share pathways with the nerves supplying the inner surface of the arm. The result? a sensation that can range from a dull, heavy pressure running down the arm to tingling or numbness in the hand. It's often described as feeling like the arm is asleep, but heavier, and not caused by lying on it. Some people notice it only briefly. Others have it persist for minutes. Importantly, while left arm pain is the most commonly known version, right arm discomfort or pain in both arms can also occur. If arm heaviness or discomfort comes on suddenly, without any explanation like injury or physical strain, and particularly if it accompanies chest discomfort, jaw pain, or shortness of breath, this is a cardiac warning until proven otherwise. Warning sign number 7, dizziness, lightheadedness, or near fainting. When a heart attack is occurring, the heart's output drops. Less blood reaches the brain, and the brain, which is extraordinarily sensitive to any reduction in blood supply, responds immediately, with a feeling of the world tilting, a sudden need to sit down, or a graying at the edges of your vision. This is particularly alarming when it happens without any obvious explanation. Not after standing up too quickly, not in heat, not from skipping a meal, just a sudden, unprovoked feeling that you might pass out. A drop in blood pressure often accompanies early cardiac distress, which further reduces blood flow to the brain. Fainting during a cardiac event is a well-recognized emergency sign. But in the days before a heart attack, you may experience milder, recurring versions. Moments where the world seems to tilt slightly, where you feel you need to grab a counter or sit down without any clear reason why. Pay close attention to unexplained dizziness, especially when it occurs alongside chest pressure, arm discomfort, or shortness of breath. Warning sign number 8, and this is the one almost no one talks about. A profound, unexplained sense of anxiety, or a feeling of impending doom. This phenomenon is so well documented in emergency medicine that it has its own name, Angor Animi, Latin for anguish of the soul. Patients describe it as a sudden, overwhelming certainty that something is deeply wrong. Some describe it as a conviction that they are about to die, even when they cannot point to a specific physical symptom. This is not a metaphor. This is not the anxiety of a worried mind. Emergency room physicians who have treated heart attacks for decades describe it as one of the most reliable signs that a patient is in serious cardiac distress. And it is the most commonly dismissed as a panic attack, dismissed as anxiety disorder, dismissed as a hypochondria, dismissed as stress. Why does it happen? When cardiac output drops and oxygen to the brain decreases, the brain interprets this at a deep primal level as a survival threat. Combined with the massive adrenaline surge of sympathetic activation, the result is a neurological sense of profound danger, even before the person can consciously identify a physical reason. If you or someone near you experiences a sudden, unexplained, overwhelming sense that something catastrophic is happening, do not dismiss it. Do not wait. Get help. Now, if any of the 8 signs we've discussed concern you, here is what your doctor should be checking. And more importantly, here is what you can specifically ask for. The first and most important cardiac biomarker is troponin, specifically high-sensitivity troponin T or I. Troponin is a protein released by heart muscle cells when they are damaged. In a healthy heart, it is essentially undetectable in the blood. Elevated troponin is the definitive laboratory sign of cardiac muscle damage. The reference range for high-sensitivity troponin T is typically below 14 nanograms per liter. Any result above this, particularly if rising between 2 tests taken hours apart, is a strong signal of cardiac injury. A 12-lead EKG is also essential. It can reveal ST segment elevation, ST depression, Q waves, or T wave changes, all of which indicate ongoing or previous cardiac damage. 2 additional tests worth knowing about for longer-term cardiovascular risk: C-Reactive Protein, or CRP, a marker of systemic inflammation, optimal for cardiac risk, below 1 milligram per liter. Above 3 is considered high cardiovascular risk. And your LDL cholesterol, your bad cholesterol, should ideally be below 100 milligrams per deciliter for most people, and below 70 if you are at high cardiovascular risk. These are not tests you order yourself, but they are specific, exact questions you can bring to your doctor. If you have symptoms, you have every right to ask for them by name. So, what do you actually do with all of this? 3 clear directives. First, if you or someone near you experiences sudden, severe chest pain, especially with arm pain, jaw pain, sweating, and shortness of breath, call emergency services immediately. Do not drive yourself to the hospital. Do not wait to see if it passes. Every minute without blood flow to the heart muscle is cardiac damage that cannot be undone. Second, if you have milder, recurring warning signs, unusual fatigue, recurring chest pressure, unexplained shortness of breath, or jaw and arm discomfort without explanation, contact your doctor and specifically ask for a cardiac evaluation. Mention the symptoms clearly, ask for a troponin test, an EKG, and a CRP level. Third, know these warning signs well enough that you recognize them in the people around you. Heart attacks don't always look the way they do in television dramas. They can be quiet, subtle, easy to rationalize. The people who survive are often the ones who acted on their body's early signals, before the damage was catastrophic. Your body is always communicating. The question is whether you're listening. If this video gave you information you didn't have before, please share it with someone who needs to see it. And subscribe to Body Signals. We post a new video every week helping you understand exactly what your body and your lab results are trying to tell you. If you want to understand how your heart's electrical system works and what happens when it develops a block or an irregular rhythm, those videos are linked here. Thank you for watching, and remember, this has been for educational purposes only. If you have any of the symptoms we discussed today, please speak with your doctor. I'll see you in the next one.